The index and middle fingers are placed on the nose. They work in 3 positions from the tip of the nose to the sides. Push caudal and release toward the little finger. The middle of the nose is treated with the same technique, again in 3 positions. The top of the nose is also treated the same way, always stretching toward the body and releasing toward the little finger. Then connect the third position of each of the previous lines. The sequences are repeated many times. Tear sacs are treated with the middle and ring fingers, using half pressure, yet still always stretching towards the body, and releasing to 0. For the lower lids, the patient looks up towards the therapist and treat in 3 positions. Close the eyes and treat the upper lids. The index finger can be supported somewhat on the eyebrows. We work directly over the eyeball, and contact lenses may have to be removed. In the upper eye socket, lay the finger horizontal, then change the hand position for the second and third positions. Here you can see how in the first position with the index finger, the stretch direction is posterior, whereas in the second and third positions, the stretch direction is caudal. Above the forehead, the hands are placed more cranial over the hair. Stationary circles in a caudal direction, releasing toward the little finger. 3 or 4 positions. Ensure that the scalp is moved and that the fingers do not slide over the hair. The index and middle fingers are placed under the ear, and the thumb makes small thumb circles on top. 5 thumb circles in each position, and depending on the size of the ear, use 3 or 4 positions. Then we treat in another line, more medial, again with small thumb circles. Circular pressure performed with the thumb, and 5 times in each position. In the third line, we use stationary circles with the index finger. The fourth position, pressure into the auditory canal, still circling. This is the third position. And now pressure into the auditory canal, and then release. Tragus is treated with the index finger supporting below, and the thumb makes small circles. Stationary circles with extended fingers, stretching caudal, releasing toward the little finger. Several positions are repeated around the ear, always 5 times in each position. The patient is placed in a side-lying position. One hand is placed on the medial border of the scapula. The cranial hand pushes from the shoulder joint in a medial posterior direction, releasing inferior. This is a shoulder blade mobilization which improves the scapulothoracic play. The fingertips are moved up and down the scapular border. The patient's arm is then switched to the therapist's other arm. We pull on the superior border of the scapula, which pulls the lateral border of the scapula over the thumb. The same movement with the thumb placed at the lateral border of the scapula, but now, in addition, the shoulder joint is moved into extension. This is simultaneously a mobilization for the glenohumeral joint. Then the fingertips are placed on the trapezius border and the supraspinatus muscle to palpate using a press and release in several positions. We are looking for painful areas with this technique. Treat with flat finger circles. Treatment of the supraspinatus muscle. For the deltoid border, we use the fingertips, looking for painful areas. And then back over the belly of the muscle using a pressure and release. If you find painful areas, treat them with flat finger circles. In an anterior medial position, we treat the long bicep tendon. First palpate, and then treat with flat fingers. In the posterior axillary fold, palpate and then treat the triceps tendon with flat fingers. The patient now lies supine and the therapist changes sides. Palpate the sternoclavicular joint, looking for painful points, and then treating with pressure and release. Palpate the acromioclavicular joint, looking for painful areas, which are then treated with flat, broad strokes. Pressure and release. Palpate around the head of the humerus in several positions. And again, treat with flat finger circles if painful areas are found. The pectoralis major muscle is palpated in the sternal area. And then in the clavicular area. The pectoralis minor muscle lies somewhat more lateral and can often be tense and painful. We palpate and then treat those areas with flat fingers. Soldier techniques around the extensor muscles. Pressure into the muscles. This is a palpation and treatment technique. Flat stationary circles in the region of the lateral epicondyle. Release cranial toward the head. Thumb circles on the affected extensor tendons. Use one thumb behind the other. These thumb circles are with stronger pressure because we want to treat the muscles. Pick up the arm and pump over the elbow from distal to proximal in flexion, and again from distal to proximal in extension. Pump through flexion, and pump through extension. With the fingertips, press into the joint spaces on the dorsal and ventral sides of the wrists. Then do the same movement on the ulnar and radial side of the wrist. Press and zero into the joint spaces. The same technique is used while moving the joint and pressing into the dorsal and ventral sides. Pressure and zero. When possible, take the joint to the end range. The movement can also be achieved with slight traction. Ulnar and radial sides are treated similarly, pressing while moving the joint. Pump technique over the wrist without movement. Try to cover a broad area. Now pump over the wrist as you move it. The movement now in extension. Lay the arm down. Pressure between the radius and ulna. Stationary circles with the soldier technique. The patient is in a side-lying position and the therapist stands behind the patient. Rotary technique over the gluteals toward the iliac spine. This is a slightly heavier technique as we are treating the gluteal muscles in several lines and many repetitions. Now the treatment of the deep abdominal lymph nodes. Stationary circles. The hands are placed superior to the pubic bone and lateral to the border of the rectus abdominis muscle. Stretch the skin with no pressure in a caudal direction, press deep, and release in a cranial direction, 5 times in one position, and repeat several times. Raise the leg, stationary circles in the direction of the fingertips over the adductor and hamstring muscles, 5 times in each position and several positions. Circle with pressure. Now work near the muscle attachments with stationary circles over the adductor longus. The knee is supported by one hand while the other palpates with stationary circles around the ischial tuberosity. Investigate the attachments of the hamstrings. The therapist changes sides and palpates the gluteus medius muscle using fingertips. Move the leg to flex and extend the hip. We palpate the muscles to find painful areas. If found, we put the leg down and treat with flat stationary circles. Palpation around the greater trochanter with fingertips, 5 times in each position, looking for painful areas in the muscles. And treat with flat fingers if the muscles are painful. You can also use a pump-push technique to treat the muscles in this area. Now the patient is in a supine position and the therapist changes sides. The iliacus muscle is treated with fingertips, pressure and release in a soaring motion. Palpate the symphysis pubis and treat with the flat middle finger if painful. Palpate the insertion of the rectus abdominis and treat with a lighter pressure. Again, press and release. The attachment of the pectineus muscle is palpated and treated with the middle finger. Work in the adductor canal with the fingertips using a more gentle pressure and release, soldier technique. Now we work over the adductor muscles with a pump-push technique, and here we use a little more pressure. Check the play in the patella. Move it medial and lateral, and then proximal and distal. And also in a circular fashion with the thumb and index fingers. Now we treat the medial border of the patella, press in a lateral direction and release. For the proximal border, press in a distal direction and release. For the lateral border, use the thumbs to press into the border in a medial direction, press and release. And for the distal border, use the fingertips to press in a proximal direction, and again press and release. Support the knee underneath. The upper hand presses over the patella toward the table. Flex the knee and press into the joint space with fingertips. Pressure and zero in several positions. Externally rotate the leg as far as possible, supporting the lower leg, and then pump over the knee from distal to proximal in flexion, and then in extension. Back again in flexion, and now in extension. Use the fingertips to press into the joint spaces 5 times in each position. Work from the middle to the sides, several positions with a pressure and release in each position. Grasp the foot and move it in dorsiflexion and plantarflexion. During the dorsal movement, press into the joint spaces with the fingertips, 5 movements per position. Then move the fingers more lateral, pressing into the ankle joint while moving into dorsiflexion. Pump over the ankle. Pump over the dorsal and plantar surfaces of the foot. Make a large surface area contact and always return to 0 on each stroke. Pump over the ankle with movement in dorsiflexion and with movement in plantarflexion. Rotate the leg slightly internally and pump on the lateral ankle over the lateral malleolus, either parallel or alternating. The anterior intercostal spaces are treated similarly to the posterior intercostals. Press into the body with the fingertips circling toward the midline. In women, we work with less pressure close to the breast tissue. Press into the body and release toward the midline. Here, we also treat the entire thorax. Bronchitis technique. The patient's knees are flexed. We work with the breathing. Release as the patient inhales. As the patient exhales, push the skin with the heel of the hand and allow the fingers to roll under the rib cage. Inhale and relax your fingers. Exhale and roll under the ribs with the fingertips. Another camera angle. Inhalation is the release phase. Exhalation and roll the fingertips under the rib cage. This should be performed without causing pain. Deep abdominal techniques. The patient's knees are flexed. We work with the patient's normal breathing. Start with the navel. In the exhalation phase, we press deep, and in the inhalation phase, we come out of the abdomen, but not completely releasing to zero. We press 5 times in each position. Now find the second position. In the exhalation phase, press deep and release toward the navel. In the inhalation phase, release, but not completely to zero, so that we can work slightly deeper each time. We want to try and stimulate deeper lymph vessels. Now we go back to the navel. This is the third position. And now on the other side, we work with reinforced hands, and only the fingers are in contact with the skin. This is the fourth position. And to finish, we return to the navel for the fifth position. Depending on the size of the pelvis, we can use 5 or 9 positions. The fingertips work into the intercostal spaces like the anterior intercostals. Stationary circles pressing into the body and releasing in the direction of the deep lymph flow toward the spine. Treat between the ribs. The pressure goes into the body, and the whole thorax is treated this way. Flat fingers are used to treat the extensor muscles of the back. The pressure direction is deep into the body, rather like the soldiers along the spine.